of the Central Florida area as a conglomeration of big cities with state-of-the-art technology and medical care? Well, in many ways, this whole area is, but our area is also home to people who live in places considered rural. And while it may seem idyllic to have a home out in the country, is healthcare in town out of reach? Welcome to UCF In Print. I'm Charna Davis-Wiese. Our guest today is author and UCF professor Dr. Angeline Nbusgy, and Dr. Nbusgy is an expert in rural medicine. Now, people might say rural medicine, that doesn't really affect me ever, but it really affects most of us. Either we have loved ones living in rural areas or will be passing through one day. And what happens if you have an automobile wreck or you get sick or you get hurt? Healthcare in those places is very important to the rest of us. And in reading your book, I was really surprised to see that there wasn't even anything written about this until very recently, until you wrote it.
Right, that's true. In fact, it was in 1991 that I published the first textbooks on rural nursing. And I think it really started when I was in my master's program at Montana State. And that was in the late 70s, and they were the first ones to one of the first universities to have a rural-focused master's program in nursing. And so they had outreach from Montana State in Bozeman into Billings. And so we would have classes once a week or once every other week for a day or two. I don't remember all the details. And part of our clinical assignments, we would go back, it was in community health, and we would focus on various populations within our own community. So we would do some research on what does health mean to you. And so I focused on, at that time I was interested in single moms. Others would go into coal mining communities. Some other classmates went into the Hutterite or the Amish communities, wherever we were at, and we would ask these questions. So at that point in time, we began collecting large amounts of data that went into the Montana State University School of Nursing. And so then they began in the mid to late 80s, began to look at this data and to look for themes because it was qualitative data. And some of the interesting things they found at that point in time, and they were just beginning to emerge, were some of the concepts of what is health to rural residents, how is it different than urban, the choices that, how you make a choice to see a doctor, or who makes the choice to see the doctor. Your care-seeking practices might be different than if you're living in an urban area. Your access to care would be different. So anyway, that's how it started, and then I was working on my doctorate, began my doctorate at that point in time, and so became really interested, and at that point in time I was looking at pregnant women, their body image and self-esteem, comparing rural and urban, and I found out, and I knew, but I hadn't really thought about it, some of the women travel 150 miles to see an obstetrician one way. I mean, that's through mountains. So anyway, the choices that physicians make in caring, that physician made, he was the only one in a radius of 150 miles, the obstetrician, the choices he made to work with that patient or that client as well as in the hospital. You know, if they come in and they're afraid to go home because the labor might start and you might be in a storm. So choices that people make and the type of practice might vary somewhat than if you were living in an urban area.
And that historically has been the case, where the doctors are really pretty far away and the women have come in to handle the health needs of the community.
Yes, I think typically in many rural communities, now I want to emphasize rural is very diverse, and I'm from the Midwest, North Central, Intermountain area, so what my concept of rural is may not be true for the South. I'm not an expert on the South. But the role differentiation between, or role expectation between men and women tends to be much more clearly defined. Men work out in the field, do this and this and this. Women are the caregivers and carriers of the culture, but they're also the informal caregivers. So you would have a healer in the community or in the family, an aunt or a grandmother in most situations, and before you went to see the doctor or even before you called the nurse, you would call this aunt or this grandmother and say, what should I do? Have you tried this? And so the women had a significant role in healing and caregiving before physicians were there.
And they were the ones taking care of the community. As you mentioned, you touched on a little bit before that the rural means different things in different places. Yes. There's farm rural, there's retirement rural, other things like that, and that will also make a difference in the type of health care.
Yes, and the U.S. Department of Agriculture has defined rural, I think they've got, 7 or 8, I don't remember all the category types.
A lot of them. Mm-hmm.
Quite a few of them. It has to do with the predominant industry in the area. And most rural areas are really locked into 1 or 2 industries and tend to be extractive in nature. Coal mining, lumbering, agriculture, and more recently what's happened is we've got retirement and service community, and if you're looking at who goes to what are retirement communities, they're usually the Intermountain areas, the amenities that are natural amenities, hunting, fishing, skiing, and then the service industry is a second part of that. So you've got military retirees, and then you've got movie stars and the very wealthy who move into these scenic mountain areas and buy up all the land, so the local people who'd lived there for generations can't even afford to live there anymore. So those are the service and the retirement communities, and that's more of a emerging trend over the last, maybe 25 years.
And that's all rural, and
yes.
Very oftentimes there's a nurse who is the one who's responsible for the care. And you also mentioned the definition of health,
yes.
because it's all relative. Everybody has their own definition, but it seems to be quite different in rural areas than it is in the city.
Yes, and that was one thing interesting that really came out of the findings from the nursing program at Montana State, and that was the rural people in that part of the country defined health as the ability to work. So it was interesting. There was an article that came out of Oklahoma, and this fellow was talking about, I don't remember the title of the article. Anyway, his story was that this farmer, it was harvest time, and there was this father of the family, and the family worked together. He had broken his leg or injured himself seriously, had to go to the hospital, was in leg cast, but it was harvesting time. But he believed he had to be out there making the rounds on the combine, never mind that he was on narcotics for the pain management, but as long as he could work,
that's
he
still
was
considered
still
driving. Right? We have to tell that's still considered driving, even though it's a combine.
So, yeah.
So he that was his definition.
That was his definition.
I've got to be healthy enough. I'm fine.
I've got to be able, yes.
I can hold on to the steering wheel.
And there's always somebody who's sicker than you. I'm bad, but you should see so-and-so down the street. He is even worse.
Now, the nurses who do go into rural nursing,
mm-hmm.
they tend to be women, sometimes men, who are from that area and go back?
Well, the ones who stay in rural tend to be from the area, and they tend to be generalists. And oftentimes, it's not just everybody that goes and moves into a little town and works in a small hospital. So we're finding out that the nurses who stay there tend to be generalists, and oftentimes from that community or have connections to the community. Now, they may marry a local boy, mm-hmm. a local fellow, and stay in the town, and then continue on with their nursing there.
A lot also has to do with the perception of the nurse who may come in and is not from there. You mentioned in your book that there's the stigma of being the outsider who is coming into town. And I guess on the other hand, the person who's always from there, it's all little Sarah over there down the street and she wants to take a look at me. So you've got both of those going on.
The insider-outsider notion, or the newcomers and the old-timers, and that can be a real source of conflict. Now, who is a newcomer and who is an old-timer? And if you look at the Intermountain West, it was people who'd been there for 2 or 3 generations. So never mind that someone lived there for 30 years. They're still, they're living in so-and-so's house, or that's so. And so they're still seen as a newcomer, even though they may have lived there for 30 years.
And that can be very difficult in healthcare, where you have to get in sometimes an intimate background, medical history, and sometimes people are a little bit more guarded when they're asked these questions.
Yes, and you just don't go and think, well, gee, accept me today. It takes a period of time to be accepted. Now, if you've got a relative, I can go back home to my little town, my parents' town where I grew up. I've been married almost 40 years. They still know me by my maiden name. I mean, I can go and they'll say, you're Pete so-and-so's daughter. And the other thing about women in small towns, in the Intermountain West anyway, they're known by some male connection, like, you're so-and-so's sister, or you're so-and-so's daughter. And it's usually a connection with a male in the family.
And that might be difficult when a nurse comes in and she has to be someone in somewhat of a position of power to get these people to listen and take care of themselves in certain ways.
Yes, and if they're not seen as such. The other thing is, even though you may have a bachelor's degree, you have to establish credibility. So you may have this woman who has been in town all her life and started an LPN program or worked as a nurse's aide, and so I'm thinking, I have a master's degree, I'm a nurse practitioner, why are they going to this person to consult with him or her? And here I am with all this education. So it takes a period of time to establish credibility.
Now you grew up in a rural area.
Yes.
And you have parents in a rural area.
Yes.
And we talked about this before, is that, you think when you're here in the big city and we have these amazing hospitals, and but we go home and we have people we love there. And we both had situations. You told me you had a situation with your dad.
Well, yes, and I think people, again, define this ability to work as health. And we were talking about cardiac, and this was a few years ago. My father's always been very active and healthy, and he's a rancher and farmer. And one day he woke up or got up during the night, and his teeth were hurting, and then the side of his neck, and he was, going around the house, my teeth are hurting, and my mother said, well, let's go to church. So they went to church, and, well, maybe we should stop and have breakfast at the restaurant and see what so-and-so thinks.
Everyone's going to be there.
Yes, and so they stopped there. Well, in the meantime, the teeth are still hurting, and so I guess they called one of my brothers, and he said, well, maybe you should go to Bismarck to get this checked, because in this little town, they had foreign doctors from Asia who couldn't speak English very well. And this is a German community, so these doctors here don't seem so good, so they decided to drive 80 miles to Bismarck. And in the meantime, my dad's still having this apparent toothache, so they stopped at the emergency room and found out that, lo and behold, this man had a heart attack and is having a heart attack, and immediately took him to...
How lucky was he?
Yes, I know. He had his guardian angel working double time, triple time. So
that's probably not uncommon.
No, it's not. And when you're looking at distance, if you don't die at home, you're not gone till you're gone, so you could probably get to Bismarck. And so the concept of driving that distance, you've got a good car, got a good heater, I hear that, got a good car, got a good heater, there isn't any ice on the highway, so again, that wasn't a problem. But when you're looking at access to care, that may also be true in the heart of an urban area, in the core inner city, and you don't have bus service, or if you're a single mom with 2 or 3 little ones, getting on the bus to go to the doctor, if you have the money, or getting to go to the grocery store, may be as problematic as it is for a rancher who lives 150 miles out.
Just as hard to get there.
Yes, just as hard. And it has insurance as well.
It's just as hard to get there. And when we talk about rural, we're not only talking about the farming communities like our family or the ranchers like your family. There's plenty of rural areas right here.
Yes. I didn't think so. Part of the reason I came to this position was they were looking at developing community and looking at rural, and I thought, oh, what's rural about Florida? Tell me. Well, I didn't really think so until one day I had to take my husband to the airport. This was when I first came, and it was raining, and I couldn't see the signs. We got lost, and he said, do you know the way? And I said, I think so. He said, are you sure? I said, yeah, I know. I kept driving, and so we stopped, and pretty soon we were off, and I thought we could be dead out here. Nobody would ever find us. And after that, I thought there is rural in Florida. It's just a different kind of rural, and the signs were down, you couldn't see, and when you're out there alone, you're more isolated than...
And it shows you that we are in that position.
That's right.
So what is the answer now? I'm sure there's no one answer or one simple answer. What can we do to bring health care to these people who deserve it just as much as those who live around the corner of a big teaching hospital? So it's the nurses going back, isn't it?
Well, first of all, we need to be aware of the issue. That's the first thing. And the exposure. Students need to be exposed, not only nurses, but doctors, physicians. And they need to be exposed to the rural environment and the rural culture. And even though you may not be practicing in that area, you may not be living there and working, most urban areas provide care to people from rural residents. And so when they're discharging and planning care for these individuals, they need to be sensitive to what is there and what isn't there.
Are we ever going to see them again? Are they ever going to have follow-up?
Yes. And what are they going home to? The other thing is exposure, because most nursing and medical education tends to be university-based, which is in urban centers. And so I always say you have young people see the stars of the city lights, and then do they ever want to go back on the farm? Eventually, many of them do if they're from that kind of an environment. So they have to be exposed, have exposure. And we have practicums and preceptors where students can go out and work in that area. And what seems to work best is the grow your own model, where people from the local community, the small town, oftentimes, and again, women tend to go into nursing and medicine, are supported by the community, go to school, come back. Sometimes they're older. This is a second career, not older, but more developed. Second career, other career choices, and they'll go back, and that seems to be much more appealing.
You touch on in the book the technology, and everybody thinks, we all have our computers in every room, and you think there's the technology there for two-way communication and conversation. But you had mentioned sometimes it tends to have, you have more technology on the farm than you have in the local doctor's office.
Yes, I was reading an article just yesterday in the newspaper. It was a feature article, and it was talking about Oregon, the connections to the Wi-Fi, and they were saying they have a large Wi-Fi tower where farmers in their field, which is a large agriculture area, carry their computers with them out there, and they can get the news and the reports or the seating or whatever it is, have immediate access out there. So it's available, and it's becoming more available. On the other hand, if you're looking at telehealth or telemedicine, where you might have the specialist in an urban center communicating with a small physician in a small town, one of the biggest problems is you might have the capability, but who pays? Who does the insurance?
Who's going to cover that?
Who's going to cover that expense-wise? So there's lots of potential there that needs to be developed, but some of it has to do with the reimbursement, the whole reimbursement.
I've been
notion.
told by some people in the medical community that some of the physicians are leaving the big city because of the medical liability problems and the insurance premiums, that it's actually a good idea to think about going home.
That may be, but they sue there too. However, again, the malpractice, if you're looking at obstetrical providers, I mean, they're the ones, some of the ones that are hit the hardest.
Real problem.
And so they're really hard to find obstetrical providers in a rural area. If you don't have a physician there, you need a physician and you need nurses. I mean, you go, it's not just nurses or doctors that are missing, it's the whole
support staff.
The whole support system. And probably one of the greatest shortages right now in rural areas is pharmacists. And you think, well, why is that? And it has to do with third-party payers or HMOs. You order your prescriptions through mail order, or you have to go to a certain pharmacy. So in many instances, the pharmacist was one of the key health educators in the little town, not only for people but for animals, and that was an informal source, and he did a lot of teaching, and they can't afford to get all these expensive meds and keep them. They get outdated in a hurry. So one of the spin-offs and is a detriment to rural communities is pharmacists are a rare breed. And so you don't see a lot of them out there.
And there's probably not an awful lot of incentive for them.
That's right.
Other than maybe just wanting to go home.
Yes, if that's their choice. But it's not I mean, when you start a business,
it's very expensive.
It's expensive, and when you're looking at pharmaceutical products and biomedical or medical equipment, that's even more expensive. It's not like going and starting a grocery store where you know people are going to come and go every day, but and to keep the stock on.
You know, we talk about those of us who live in a big city, and you wonder if you'll ever be exposed to this. And last year, our 5th graders went to Williamsburg, and there were buses, and they were heading from one place to another. My husband was one of the chaperones. My husband's a physician, and a woman on this road flipped her car. And it flipped and it went over a couple of times. And we've discussed this before in our family, that when the Good Samaritan is often the one who is fatally injured, who is very badly hurt in these situations. And an ambulance would probably get there more quickly, and the people inside the car survive. And we've had this discussion, and my children were always quite afraid of what would happen if Daddy goes out to help. And the other fathers immediately called on the cell phones home to the mothers to use this as an example, because the woman was on the cell phone. So I got the story as it was happening, that my husband was out on this road with 4 other men and 1 woman trying to help this woman out of the car. And fortunately she had her seatbelt on, so she survived it. But he said, do you know how long it took an ambulance to get there? It was almost 30 minutes.
Well, let me tell you a scarier story, and that is, I lived in Utah. I was at the University of Utah. In northern Utah, it's in the Intermountain area, hunters, they have one of the largest tourist populations in the West. They did not have any first responders, much less, I mean, this 2 or 3 county area, it's called frontier area, and that usually means less than 6 people per square mile. They didn't have any first responders there. Didn't have doctors or nurses, but not even first responders. So several of the mayors of these little towns took the EMT course in case somebody was shot or whatever. At least they would have a first responder there. If you had to get an ambulance there or a helicopter, it might take you several hours if there's a dust storm to get there.
That's what people think. Those of us who live in the big city think, oh, they'll just get a helicopter out to these people, but that doesn't happen.
And so when
easily.
Tourists come out there, I don't think they have a clue. It's part of Wyoming, and right on the Wyoming, Utah, Montana border in that area, very remote. It's Intermountain area, and no first responders, never mind doctors or nurses in that whole county. So it's interesting. It's really frightening when you think about it. You want to think about when you're out there hunting or driving. Plus, you have the cold, you have hypothermia,
all kinds of things going on. We also talked about the forgotten rural, the homeless, and it's a totally different type of homeless population in rural areas.
That's right. Well, you have different kinds of homeless. You've got the migrant farm workers, who may or may not be homeless. I mean, this is part of their track, but they live in their cars or they live in the shanties, but usually they have a route. And usually in that part of the country, they're a part of an extended family or an extended network. I mean, they work with people. But then you have others in the community where the farms are foreclosed. They can live in their own house or period of time. They can take everything but your house, so they might live there, or they might live with relatives. Or sometimes you've got people that are not in agriculture, but they work in day jobs where they just work, and they work every day. They go on a job, they're on a, I forget what they're called, but like day laborers, and they make enough, and so they'll stay in a hotel one night and a car the next night, and so they're kind of lost in the shuffle. And usually there's not a lot of resources, or if it's a displaced woman, a domestic abuse, you don't have shelters and things in those communities. And people know each other by cars, so, or you know, everybody knows everybody. So if you go to a home health department or a homeless shelter or the health department, oh, there's, or the mental health services, oh, there's so-and-so's car, I wonder what they're doing there.
Mm-hmm.
So the whole notion of anonymity and confidentiality
is
pretty much gone. Plus the services are not there because you don't have the population density to support those kinds of services.
So
as
what
well.
happens to them? It's probably what we expect would happen.
Oftentimes family supports them, take care. Some, you know, they support each other. Sometimes they'll go to an urban area and find a job. They'll go out, or depends, different outcomes.
And family is very, very big in the whole rural area.
Generally, yes. Again, we have to say there's a lot of diversity in how things are happened, and families are different, but they tend to be, especially in some of these homogeneous communities, they've lived there for numerous generations, and so they support each other. So it is important, and they self-reliance and the whole notion of community support and reciprocity. I'll help you out, and then someday you'll have to help me out. And so these informal support systems in many ways reinforce or make up for some of the formal services that are not there.
Lacking, and perhaps that's probably the best way to get by for right now, because there's a nursing shortage everywhere.
Yeah, there is a nursing shortage. However, if you have a nursing shortage in rural, you might have one nurse. You're short one nurse in the hospital, and you think, oh, I have a 20% vacancy rate. That's only one nurse that's pregnant, or whatever, for a period of time. And in an urban area, 20%, you'll think, what's going on here? So you have to look at it in
it's all
proportion.
relative.
Yes.
So what if a young person decides, yes, you know what, I think I might like to do this. What's the difference in the route and the education and the way they go about helping to change this?
Well, I teach rural course. The rural course in the nursing. I've taught it for a number of years. I think one of the most important things is just knowing what it's like out there. Some of the realities, it's not idyllic, and sometimes nurses think, oh, I'm going to go and save the world and find a man or find a wife or whatever, and it isn't that way. You have to be generalist. You have to be a good, strong generalist. So if
you have to be able to handle whatever
comes along. You've got to be flexible, be aware of the rural culture, that it may be different, that you may be an outsider, that you don't go and just be the star of the first day.
It's not like they're all waiting for you to come with open arms. They'll be nice, but you're still not one of them.
You need to work with the community. So again, this whole notion of working with the community and becoming part of the community. And rural communities are becoming, they're diverse, and so I think some of them are more open. They want health care as well, and they're older. People tend to be older in rural communities. So
people who stayed there. So do you think it's going to get better?
Well,
it's hard to ask you.
I don't know. I think things are getting better in the population is growing. The population is
even in the rural areas.
Even in the rural areas, and when you look at rural, I usually think of the little small towns. There aren't a lot of little small towns around. They're far and few between. So even states that you think are rural, they have a large rural area geographic-wise, but if you look at the population, most of the population may live in the city areas and or commute into that area. So, I think we're looking at inequities in healthcare delivery and inequities in access to healthcare. We're looking at personal responsibility. I think telehealth is going to have a bigger role, connecting people through technology. And the other day there was an article, it was in the Washington Post, looking at computer in the home and internet access. And it was surprising to me because I looked at rural areas, and it seemed to me in some rural areas they had more internet access,
really?
A higher percentage than in more populated states. So
Do you think that helps for the people who are computer savvy, and probably a lot of the older people may still be a little bit leery of using the internet, the WebMDs, that kind of information? Is that helping, or is it?
I think we have a better informed consumer these days. I mean, there's so much information there, and just the idea that when you go to the doctor, you may not get a pill. I mean, it used to be when you went to the doctor, if he didn't give me an antibiotic, notice I'm using the word he, if he didn't give me an antibiotic, what was the use of going to the doctor? So now we're finding out that, hey,
you don't want an antibiotic.
You don't want it. I mean, that's the last thing you want. So, I mean, I think we're getting a better informed consumer, and it's generational. I mean, it doesn't happen overnight. It takes a full generation to bring about change. So kids are learning this in school. And who do parents learn, or grandparents? They learn from their children. And so I think we're seeing a better informed consumer. Plus, medical health insurance companies are really educating, pharmaceutical companies are educating. So I think things are changing, but our whole healthcare system is changing.
It has to.
It has changed already. So.
It has to. You have 5 books?
This is my 5th one.
This is your 5th one.
Yeah.
Are you working on something right now?
Well, not on a book right now. I'm editing several journals. So, rural nursing is not like a community assessment or a health assessment book. It's not a big market area. However, people are becoming more informed. And the other interesting thing is, anytime you write a grant, NIR grant, or for health. You always have to include the disadvantaged and bring in some rural or minority groups. So that's a big piece of it. So I think people are becoming better informed.
That's the greatest. That's probably the greatest hope.
Yeah.
That for people to get money for some other things, maybe the people in the rural areas. So it's that maybe the greatest hope for us, for people who live through rural areas, love people there, travel through there, is that information and education for us to take our own responsibility is probably the only thing we can do right now.
And we are living in a global society. I mean, we're rural here, but when you're looking at rural, it's an international perspective, and people in rural areas generally do not. I mean, think of Africa and some of these areas. They even have less access, or even Mexico for that matter, or northern Canada for that matter.
Yeah.
So.
And it's very interesting when you think of people, we're going to go to Canada to get our medication, but then many people come from all over the world to come to the United States for medical care.
Yeah, I mean, we just saw the other day where somebody got a heart transplant or something in California who moved up the priority scale by 300 or 400 because he came from one of the Mideast countries and he had enough money to get the. So it's always a surprise to me. I don't have the answer.
And that's a whole other show, right?
That's right.
Dr. Angeline Nbusgy, just number 5, nursing in the rural community. Thank you so much for shedding light on something that's really important to so many of us.
Thank you for
asking.
Us. Thank you.
I'm Charna Davis-Wiese. Thank you so much for joining us today, and we'll see you next time on UCF in Print.